Say good morning, everyone. Here is our agenda for today. We will be providing a system of care and department updates. We will provide an overview of the data and information sharing. Lassen and San Mateo counties will be presenting. And then lastly, we will have an opportunity for some questions and answers. Next slide, please. And then for the system of care updates, I am going to kick it off over to Ashley.
Right. Good morning. We were going to share some updates. Sorry, having a little technical issue getting this up. I actually am sharing some CDSS updates. Wanted to let you know about some updates with Wraparound and peer partner hubs. We've engaged leaders in Wraparound from child welfare, behavioral health, probation, fiscal providers, youth, and parents to revitalize Wraparound in California. And also have some upcoming Wraparound hubs with CWAC. So more information, I'm going to post a link into the chat for you to access more info on the WRAP updates. And then also wanted to share specifically related to the peer partner update. There are some great information out there introducing the peer partner hubs. There's evidence emerging that peer partner programs are effective in helping youth and families in lots of ways, connecting moms and dads to parent partners, instills hopes, promotes self-advocacy, helps connect families to services, and also promotes a culture shift in agencies to one that engages authentically with families. There's some great information emerging about children and youth demonstrating improved social skills as well as more comfort and trust relating to others as a result of mentoring or peer support from youth with lived experience in systems such as child welfare, probation, and behavioral health. The Parent Partner Advisory Committee, in collaboration with CDSS, are proud to introduce peer partner hubs for a safe space for peer partners, including youth and parent advocates with lived experience in child and family serving organizations to network and support one another. So there will be some peer partner hubs offered virtually on October 15th, January 14th, and April 15th. And I will also post those in the chat box in a moment for you to register and or find out more information. There is an Institute for Innovation and Implementation, a conversation on supporting parents, infants, young children, and the workforce that serve them with national early childhood mental health leaders. And that will provide some conversation as communities continue to respond and adjust during COVID-19 for parents and caregivers dealing with complex learning and behavioral challenges. Meant to provide some valuable resources and learning opportunities. That is coming up on October 27th. I will include that link for registering in the chat also. I'm going to share some information on presumptive transfer, provide a link to their website where you can find good information and resources. When a child or youth is placed in another county, the responsibility for specialty mental health services is subject to presumptive transfer. CDSS has a variety of useful tools and information available related to presumptive transfer on its website. So I'll share that, like I said, in the chat box for you. The link has policy letters, information guide, and provides a written overview and a recorded training webinar for sharing more information and supporting that. And then lastly, wanted to share some information about a training coming up. Dr. Haley Scott is providing trainings on supporting youth in foster care with intellectual and developmental disabilities. Going to share the link for that. There are a few trainings coming up in November. They're open to all counties. And there's more information on the CCR website that I will post in the chat box. And then I believe there may be an additional update that Richard may want to share. And if not, we will move on to the next update.
I think I'm good, Ashley. Thank you.
Okay.
Hi, my name is Christine Bagley. I'm from the Department of Developmental Services, and I work on the System of Care state team. So I just wanted to kind of do a plug for Early Start. We know COVID has had a lot of impacts on our children and families. And when we have been looking at data and compare like monthly averages from last year, from January to August of this year, we're seeing a 19% decrease in Early Start referrals. There's a variety of reasons for that. Not accessing, pediatrician services, families making kind of basic needs a priority, face-to-face development screenings being canceled to comply with stay-at-home orders. And also really just the interaction of families seeing their kids play with other children and being able to kind of pick up on something. While we are seeing some upticks on a month-to-month basis, we've seen some upticks since June, they're still pretty significantly lower than last year. Of course, the regional centers in the department are doing a variety of things to really make sure that we're increasing people's knowledge around referrals, leveraging staff to kind of access underserved groups, like partnering with local partners like Help Me Grow and First Five, virtual town hall meetings, developing outreach materials and such. But I just wanted to kind of share that with all of you because in your interactions with our 0 to 3 population, I just want to kind of put that plug out there that regional centers are still taking referrals, and it's really important to get those babies early intervention services. So I'm going to put in the chat 3 pieces of information. I'm going to put in our Early Start email address to the department. So if you have any questions generally, feel free to reach out via email. I'm also going to put the phone number for our baby line, and that is like a warm line where people can call, parents, doctors, nurses. We get calls from out of state, and then somebody from our department will provide linkage information to the regional center Early Start intake services, the family resource services, and kind of be that kind of linkage to get people the information they need for their regional center. And then I'm also going to put a link to our website that on the Early Start page, and it has all of the regional center Early Start intake phone numbers, as well as the Family Resource Center that works in partnership with the regional center. So it's a really kind of great tool for your toolbox to share with resource families or providers that maybe, it's on their radar, any pediatricians or local partners that you work with. So I just wanted to share that with all of you, and thanks for being here.
Excellent, thanks Christine. So I should have introduced all of the System of Care partners at the beginning, and I didn't. So let's go through our partners for the System of Care. We've got our partners from the California Department of Social Services. You've already heard from Ashley Franklin. Who else is here from CDSS?
Good morning. Thank you all for being here. Diana Wagner. I'm a health program specialist with California Department of Social Services.
Hi guys, Rich Connect, Integrated Services Advisor.
Excellent. And then how about from DHCS?
Good morning, everyone. This is Lindsay Merwin with Department of Healthcare Services. I work on this System of Care state team, and I'm also part of the Medi-Cal Behavioral Health Division within DHCS. Thank you for joining us today.
Good morning, everyone. My name is Olivia Almaraz. I am also in the state system of care team, and I am a health program analyst with the HCS. Welcome.
Okay, and you've heard from Christine, but Christine, anybody else from DDS?
No, just me.
Okay, great. Thanks, Christine. We also have partners from the Department of Rehabilitation Services and the California Department of Education. So Nancy, I know you're here.
Good morning, everyone. My name is Nancy Wentling, and I work for the California Department of Rehabilitation, and I'm a manager in our program policy section, and I'm really happy to be here today. And everyone have a great, enjoy the webinar.
Thanks, Nancy. And then anybody else from CDE or anybody I missed? Excellent, great. It's a great team. So sorry we didn't do that at the very beginning. And then are there any other updates to add from anybody else? Any other partner? Okay, I'm going to type in the chat window some information about the Breaking Barriers Symposium, and I'll have the website for that, and I'll put that in the chat window in just a moment. And I think that means that it is time to move on. I will introduce Lindsay. Is that you going right now?
That is me.
Great, excellent, Lindsay.
Thank you. So just some background and context for the MOU content on information sharing. So information and data sharing are complex issues. And mean different things to partner agencies. Numerous federal and state policies apply. Local alignment must comply with policy and overcome barriers, which is critical to successful care. Children and Youth, the System of Care invites considerations for information sharing for individuals and students, as well as organizational data sharing between agencies. Today's presentation will focus on client and student information sharing. Next slide.
So in the good care dilemma, there are two foundational obligations that are sometimes in conflict. And those are that providers and service personnel must protect the confidentiality and privacy of clients, and they must also deliver timely and effective services and care coordination.
And in fact, the integrated core practice model is one of the tools that the state has available. Well, did we skip a slide?
Yeah, I thought we were moving slides, so I'm not actually sure what slide we're supposed to be on right now. Sorry.
So Olivia, are we good?
Okay.
So let me just spend a minute and just highlight that the integrated core practice model is intended to support local partners in identifying the best and most effective ways to share student and youth related information. So we've pulled a couple of quotations from the practice model, and when sometimes when there are challenges to sharing of information, it's always useful to be reminded that it's a place where really our engagement with one another can come into play. So this is an issue of trust, and trust is premised in effective engagement. It's trust between organizations, departments, and agencies. It's trust between professionals who work for those organizations. And of course, critically also, trust between professionals and those in service, youth, clients, and their caregivers. So engagement skills are critical to establishing a relationally based agreement for how information will be used, and can be effective when we sometimes get stuck in balancing the dilemma which Olivia just outlined. Next slide.
And part 3 of the AB 2083 MOU guidance is information and data sharing. It states that system partners agree to the fullest extent allowed by law to share the necessary and relevant client-specific information in order to conduct treatment, coordinate care, and ensure the highest quality care is available to youth and caregivers. Next slide, please. Another quote from the AB 2083 in regards to the provisions of data and information states that members of the interagency leadership team may disclose and exchange information or a writing with one another that may be designated as confidential under state law if the member of the team having that information or writing reasonably believes that it is generally relevant to the identification, reduction, or elimination of barriers to services for or to placement of children and youth in foster care or to improve the provisions of those services or placements. Next slide, please.
All right, so there are some basic assumptions that are anchored most often in code, either at the federal or state level, and we'll be digging into these in a couple places in the next few minutes. But we wanted just to establish that the code provides guidance generally for us in terms of how we balance the sometimes conflicting obligations to provide timely care while protecting privacy and confidentiality. All of that, of course, driving towards effective service planning and delivery of care for youth and students. So rooted in a Welfare Institutions Code, there are some basic expectations around the fact that we will, as partners, share data, and that we will protect that data, and that when we're completing, when we're done using the data that's been shared with us or the information that's been shared with us, we're going to destroy it or return it to the owner of that information or the agency from which we obtained it. And of course, as always, a reminder that that kind of information is strictly confidential and not open to public purview. Next slide. Further in the guidance that comes from the state and anchored in code in various places, you'll note that the members of an interagency placement committee or a child and family team that is convened for the purposes of implementing system of care or collaborative services are obligated to comply with applicable statutes of confidentiality, right? So this is something we all recognize and that we're all well trained to do, but 2083 and its related state guidance just really anchors that. And so I think that's probably it for that slide.
Some guiding questions to keep in mind are the following. I'll give you guys a few. Do you have an operating MOU or interagency agreement to allow for the sharing of child-specific information across partner agencies to support timely access to services for children and families? Is assessment information shared across systems to avoid the over-assessment of youth and families? Have you engaged your county council and privacy officer as you develop child-specific information sharing policies? Next slide, please. And a couple more. Is there a process established to ensure that confidential information or writings are destroyed or returned once the purposes for which it was disclosed or exchanged are satisfied, just like Richard stated previously? Do members of the IPC, Child Abuse Multidisciplinary Personnel Team, or CFT know the policies regarding confidentiality laws and records retention for their respective agencies or programs? Next slide, please.
All right, so as local system partners are in the process of constructing their blueprints or their memoranda of understanding around system of care to comply with 2083, the question I think naturally arises, what belongs in our MOU by way of content in this area? because there is, of course, a specific section within the MOU that defines this. So generally, what we'd like to suggest is that the MOU contain sufficient detail that outlines an agreement and characterizes that to the fullest extent that the law allows, that the partners will share relevant, necessary student youth information in order to conduct care, to deliver assessment and treatment, to coordinate care, to effect good transitions, and otherwise deliver the highest quality of care possible. It's a bit of a balancing act in terms of how much information goes into your MOU here. Obviously, if we put too much information in the Memorandum of Understanding, it gets to be a long document. We'll have some additional thoughts about that later on. But the alternative is to have just too brief an information that doesn't really capture what the partners are agreeing to. So it's a bit of a balancing act about what goes in the MOU. It needs to be detailed enough to establish what the commitment is and what the goals of that information sharing are. But in many respects, some of the detailed information probably belongs in policies and procedures rather than in the MOU itself. Next slide. So within the System of Care Toolkit that you're all now quite familiar with, there are some suggested practices for success in this area. And so we would just highlight some of these for you quickly this morning. Ideally, in a couple of counties we know have been successful in this regard. Ponder on whether or not it's possible to have a single uniform release of information form that can be used across all of the system partners. It can be a powerful way to connect our systems to not have to use each other's forms each time we want to share information that's required by a release. Sometimes it can be helpful to consider the degree to which other partners might need to be involved. If you have partners beyond your system of care, for instance, who are frequent recipients of information or owners of client-related information, it might be useful to involve them in a collective release form as well. And of course, underlying this whole premise is this idea that timely and appropriate sharing of assessment data in particular gets us off to the right start when working with kids and families. And so it's really the essence of system of care and good care coordination to make sure that that early assessment information is effectively shared. So further anchoring in the state code, we want to establish that that there's support there, specifically that in some instances, a release of information form is not required. We're going to explore this in just a few minutes in some greater detail. But we would just draw your attention at this point to the WIC code cited here that clearly articulates that there are situations where you don't need to obtain a release before you can begin to coordinate care for young people in the system. Next slide. And of course, balancing that on the other end of the spectrum, again, is that information that is exchanged is held in confidence and limited to the very prescriptive use for which it's intended. The Welfare Institutions Code, along with federal privacy and confidentiality code, is really rooted in two concepts, right? It's about two ideas: minimum necessary information, so you only share what is necessary to do the job at hand, to coordinate care in this case, or to serve young people within a system context. And the second principle, of course, is needing to know, right? Does this person or does this agency really need to know this information? Those are really the underlying premises that form the basis for all state and federal code, and they're really kind of the spirit of the law, if you will. So the idea of minimum necessary and need to know are fundamental, and you see these reflected in code. With that, we're going to yield to Ashley, who's going to walk us through some really interesting information that comes from some federal and state authorities.
Thank you, Richard. So I'll kind of walk us through this and then hope to hear from you all if you have questions, or from Richard for any extra context that he can share. So this FAQ number 1, does the privacy rule permit healthcare providers to share patient health information for treatment purposes without the patient's authorization? And the answer for that is yes, the privacy rule allows healthcare providers that are covered entities to use or disclose protected medical information for treatment purposes without the patient's authorization. This includes sharing the information to consult with other providers, including providers who are not covered entities, to treat a different patient or to refer the patient. There's some information there and a link that you'll be able to access when we post this webinar on HIPAA for professionals. And if there's anything you want to add, Richard, you are welcome to. Otherwise, we'll go to the next slide.
I appreciate that. I think one of the important inquiries here, and the reason we're sharing this from the Office of Civil Rights, is that it really invites us to challenge the notion that a formal release of information is required before we can even, utter the name of a particular client. So it really invites local decision makers, as you craft your MOU and related policy, to ponder on the historic practices that have developed over the last 20, 25 years post HIPAA. Recognizing, of course, HIPAA is not the only law. But the reason we're including these FAQs is just to begin to invite us to think a little bit more progressively about the utility of the law as it provides for privacy and confidentiality, but also allows us to coordinate care in many instances without formal authorization.
Great. Next slide, please. Does the privacy rule allow a provider to share health information about a student to a school nurse or physician? Yes, the HIPAA privacy rule allows covered healthcare providers to disclose PIH about students to school nurses, physicians, or other healthcare providers for treatment purposes without the authorization of the student or student's parent. And again, another resource listed for you that you can access when this is posted. And why was the consent requirement eliminated from the privacy rule, and how will it affect individuals' privacy protections? The consent requirement created the unintended effect of preventing healthcare providers from providing timely, quality healthcare to individuals. The most troubling problem was that healthcare providers would not have been able to use or disclose protected health information prior to the initial face-to-face encounter with the patient, which is routinely done to provide timely access to quality healthcare. To eliminate such barriers to healthcare, mandatory consent was replaced with a voluntary consent provision that permits healthcare providers to obtain consent for treatment, payment, and healthcare operations at their option, and enables them to obtain consent in a manner that does not disrupt needed treatment. There's another resource for you that you can access later. And Richard, anything you wanted to add to this?
Just that I think what we love about this from the Office of Civil Rights webpage and their FAQs is that it clearly acknowledges that federal policymakers are aware that we have in many respects overweighted the impetus or the purpose of HIPAA. The second P is for portability, which invites us to think about the flow of information, not just in terms of how the owner of that information carries it from one provider to the next, but how providers use that information. So I love that OCR federal folks have really challenged the notion that absent a more fluid and dynamic and timely sharing of information, that referral process in particular gets interrupted. And this is the gap that so often we fall into as patients and consumers of healthcare services in this country. And so this is just a powerful reminder that we can't let the prescriptiveness, often the overweightedness of this get in the way of good referral and transition planning processes for our young people. We can go to the next slide.
Do we need a release of information to share CAMS information? County placing agencies and county MHPs must share CAMS assessment for children, youth, and non-minor dependents assessed and or served by either system, and a completion of universal information release form shall not be required for this purpose. Any context you want to add to this one?
Nothing from me, but it's clear that the state has provided guidance for us in this area, so it's a good reminder.
We're ready for next slide. And panelists, I'm not, oh, perfect timing.
Hi, so Richard or any of the panelists, if you want to chime in, we do have a couple of questions here. Wanting to know a little bit more information about 42 CFR Part 2 and the impact that it played in California a couple of years ago as it relates to substance use treatment and care coordinations. And do we have any information on how we see that working across systems at this point?
I would just invite local decision makers to visit on the impact of state code versus federal code in your local conversations. There are a couple places where there is very specific guidance. I think Judy Weber from Ventura pointed out earlier that some folks tend to assume that the federal code takes precedence. I've heard legal experts and privacy officers suggest that the state code is actually more prescriptive and should be the dependent guidance. So we're at the state, we're not, I think, in the business of telling you locally exactly what you should do. But just trying to make you aware that in many respects, we have overburdened ourselves with both state and federal code interpretation, and that there are ways to navigate through the sharing of information in ways that are a lot less burdensome for systems and for the young people we're seeking to serve as all. So that's my reflection about CSFR 42.
Thank you, Richard.
Mm-hmm.
So we have another question here, and I'm just going to read it from our chat box. Challenging client authorization for information by the client is troubling for behavioral health point of view. The question is, why is this being challenged? Is it so difficult to get written permission from the client or responsible party? Good referral and transition planning should be included, the client or their responsible party.
So I'll take a stab at that, and thanks, Brock, for the inquiry. I think your second question in there is really the driver. So in fact, it is quite difficult often to get written permission in a timely way. So the experience we have seen locally in many jurisdictions and many systems, frankly, both public and private, is that getting a written authorization from the holder of the privilege or the holder of the capacity to authorize the release can be a very difficult process when folks are not engaged and connected to the care team, for instance. And so we'll see young people in systems wait, sometimes not days, but weeks for even a referral to be made. Or for a good discharge plan to be communicated to the next provider because we're waiting for authorization. And that's the intent of much of the conversation at hand is to challenge this notion that I can't release basic information that's already been consented to in other ways by virtue of my presence in a team meeting or my prior consents, for instance. There are lots of prescriptiveness that we have tended to rely on that are simply unnecessary, and it does interrupt care delivery. So that's really the imperative. If your system locally allows you a really fluid and timely way of obtaining written consent, that's great. But many times, this is the driver to the care interruption that results in poor coordination, poor transitions. And it's in those periods of time when often young people experience crises, and if the care providers aren't in place, then we've lost kids to the gaps in the system.
Sorry. Thank you, Richard. Another question that we have for you, given your experience, what have you seen work well as far as information and data sharing?
So specific to the MOU, I think that's a big question, Diana. So I would just offer that in my experience, the MOU should contain enough detail so that partners understand that not only are we making a commitment to share information in a timely way, but some guidance as to how we're going to do that. And you can't get too prescriptive, as we stated earlier, because then you've got multiple pages in your MOU that really belong in more practice level guidance for practitioners, social workers, therapists, case managers, et cetera. So there's that balance point. What you need is a commitment to share information, and just enough about how you're going to do it, the processes, to be able to anchor the collective agreement to share information.
Thank you very much, Richard. So now I have the pleasure, if you want to move the slide forward, Nancy. So now I have the pleasure of introducing San Mateo County, and I am going to introduce Anjanette Pelletier to introduce her team of folks that are going to come and speak to us this morning.
Hi, everybody. I'm super happy to be here. And we do have several team members here with us today. We actually have a slide where we're going to introduce ourselves. And Nancy, just want to make sure that Ziamara Rodriguez has been added as one of our panelists. We sent you her working name.
Yep.
Great.
Perfect.
Excellent. Thank you.
Sorry about that.
So thank you for inviting us. Thank you for having us. I appreciate that you're having me introduce us, but actually this is not a me presentation. This really is a presentation joint by the San Mateo County Office of Education, San Mateo County Health and all of its arms and divisions, and San Mateo County's Youth Serving Services, Child Family and Services, probation, et cetera. We have long-standing partnerships, and we're really excited to be here. So I think I'm actually going to turn it over to John Fong, and you could probably go to the next slide.
Hello, everybody. My name is John Fong. Can you all hear me?
Yes.
Good, perfect. I am the Director of Children and Family Services, San Mateo County, and I want to thank you all for having us here today. Our small but mighty team comes to you from San Mateo to tell you a little bit about our system of care for foster youth in our county. So as you see on slide 1, our work in our county dates back to 1988. When we actually received a grant funding from the California Mental Health Division to develop a process for coordinated care for our youth. Successful project to the extent that we received the support of our Board of Supervisors And we continued that work to date through a committee known as our Children and Youth System of Care, otherwise known as CISOC. Next slide, please. So sounds simple, but collaboration is the strength, right? Cross-system collaboration has been the key factor in the strength of our continued partnerships. But formally, we have several MOUs between our systems outlining our shared responsibilities to include our CISOC MOU. We have a global MOU with BHRS, specifically outlining our mental health service agreements. We have an MOU with our San Mateo County Office of Education outlining services provided by our foster youth educational liaisons and the team over at our Office of Ed. So formally have structures in place that have supported this partnership and worked through the years. Our CISOC group specifically, who's here today, we meet 1 to 2 times per month. We continue to convene a work group of supervisors and managers that spawned from the Pathways to Wellbeing work that started years ago. We also, more recently, have convened a new work group related to our CANS CFT integration. And you know, last but not least, we have a strong commitment to our interagency placement review process that is known as IPRC in our county. So I can tell you that leadership at all levels across agencies, you know, we're meeting formally, informally to ensure continuity of care. Also includes partners outside of the current CISOC MOU agreement. So as a relatively new child welfare director, I feel pretty fortunate to have the strong system of care in my county. So without further ado, let's meet some of our current CISOC partners in San Mateo County, which includes child welfare, includes probation, behavioral health, County Office of Education, as well as SELPA, which is where Anjanette comes from. Next slide, please. So again, I'm John Fong, Director of Children and Family Services, and I'll pass it to my partners.
Good morning. I'm Xiomara Ochoa, Deputy Director for Child and Youth Services with Behavioral Health and Recovery Services. Michelle Kozel couldn't be here with us this morning, but hopefully for the next round.
Yes, absolutely.
Good morning. Good morning, everyone. My name is Janae Latrell, and I'm the Deputy Superintendent for Educational Services at the San Mateo County Office of Education, and I'm happy to be here. I'd like to just give a little disclaimer as the presentation starts. You'll see below here that we have other participants who contributed to this presentation and are active members of our CISOC group and other working groups we have. Mary McGrath, namely, is part of my team, and she was supposed to be on the presentation panel today, but fell ill. So as I cover my slides, I love the support of my team, but that's what we do anyway. So I'm happy to be here.
And I'm Anjanette Pelletier. I'm the Associate Superintendent for San Mateo County SELPA. And in my region, SELPA is connected to San Mateo County Office of Education. And we do a lot of interagency collaboration with not only the 4 core partners, but also with other soon-to-be partners, including Golden Gate Regional Center. So SELPAs have a lot of interagency connections as well. And I'm happy to be one of the supporting members for the CISOC team.
Thank you, team. And we are fortunate in San Mateo County as well to have a clinical team embedded within our child welfare agency. Natasha Bourbonnais is not here today, but she is our child welfare clinical manager and integral to our continued work as a system of care. Next slide. So where do we go from here? Obviously, given we started our work decades ago, we have a strong foundation to include an existing system of care MOU. But that said, AB 2083 has brought us some nice opportunities, which also includes revision of our existing MOU. As Anjanette mentioned, it also, probably most importantly, has allowed for us to expand our interagency leadership team which will include our local regional center, Golden Gate Regional Center. So I'm thrilled and excited to include Lisa Rosine from Golden Gate Regional Center and her team to our group. Also other potential partners like our Regional Department of Rehab, our courts, and potentially parent and youth partners as part of that ILT as well. AB 23, it's allowed for us to kind of take a second look at our governance structure and the different layers of our partnership, which has been a nice part of our process. It's also encouraged us as a system to engage in dialogue about the integrated core practice model and also include ICPM principles and language within our revised system of care MOU. So as we speak, we're in the process of deconstructing our existing system of care MOU. It's been a nice opportunity for us, as I said, to kind of just reset as a system. Our target completion date for that revised MOU is at the beginning of the year, so January 1st, 2021. So without further ado, I believe we have some other questions that were forwarded to us prior to this presentation, which we're hoping to get into in the next slide.
So I'm just going to set an overframe. We did receive some questions from the technical assistance group. And to be honest, for some of the questions, we didn't really have like answers that could be put in bullet points because we're still working on some of those details. So we thought we would put up the questions and then we would speak to either our current work or work that we're currently doing to address some of those issues ourselves.
Thanks, Anjanette. That's a helpful frame. I'd like to speak a little bit as John was just talking about the impact of the work. In addition to the work we've done in SciSoc and since the late 80s, what I'd like to suggest and share with you is different examples of how the partnership with SciSoc, how the way that we come together and recognize that working together better supports the student. We have reduced the fragmentations that come because of our system barriers. Whether it's the information sharing challenges that can come at times, or just even our discipline myopic lenses that can come at times. So we do have tools and processes. Some of them are embedded, as you heard John talk about. We have educational liaisons that partner actively with the social workers on a daily basis and with our school partners around the needs of students that are connected to the child and family services system. But because of this relationship, we've also built, we call them safety nets in our county. So we have additional safety nets that are a continuum of the work of SciSoc and our agreements. One of which is a threat assessment team. So when we have a student that is identified as potentially a concern, we get together at the table with members of John's teams, with members from probation, with members from Ziamara's team, and our school partners, and we're looking at what is that student in need of, and that's just one example of many processes. So what I'm trying to articulate here is that we have learned in our county that my lens is just that, and that I need to hear from my partners, get their lens and get their expertise, so that when we create a plan to support a young person, it's a holistic plan. It's the right plan for that young person, and that we are getting out of our own way so that we're not creating additional hurdles. And so we do have some actual tools and processes, whether it's in the CFT process or again, threat assessment. We also have our CSEC MDT. We have a variety of different work groups, but what I love is that when we get together, we look around and say, where are our partners? And who's going to be our BHRS representative? Who's going to be our SELPA partner in this conversation? And we're way beyond having to convince people that it's the right work to do, so much because of the success of this team. Next slide.
Our next slide is communication protocols.
Yes. So in addition to the MOU that you just heard, John, that we're working on and we will have updated, we have a broader information sharing agreement that we in San Mateo County passed in 2012. It came together after the Sandy Hook shootings, and it came together as a multi-system. All 24 districts in our county have signed on to it. BHRS has signed on to it, Child and Family Services, Probation, and our law enforcement agencies. And the overarching commitment in that MOU is that we are going to share information that's relevant and timely and that supports the young person with whatever needs that they have. But again, it's always going to be towards the lens of getting folks served in the right appropriate manner early, as quickly as possible. So we're so fortunate that we have that commitment, and then that's the broader commitment. So then we get to carry it into meetings such as 504 conversations or IAP conversations, or again, CSEC MDT meetings. So we have realized a long time ago that you can have agreements, but if you don't have them embedded in your practice, those agreements sit on the shelf and don't change anything for that young person or for our systems. And so we're really committed to active ongoing trainings, to operationalizing it, to really helping even our brand new school counselors that walk in the door. We orient them to, this is the way we do it. And even though you're coming out of a grad program and you heard a lot around confidentiality and we never want to violate that, we have special agreements in our county and we have a different way of working. So I'm excited to share with you that this really is the way we do business, but we also have ways of sustaining it and making sure it carries on independent of which of us is sitting at SISOC table.
One of the things that allows us to have that communication agreement is that we have a really strong county council relationship amongst all of our divisions in San Mateo County. So almost all of the districts use county council for special education support. And in many cases, we have the same council providing us information and access. So that center core of county council, as Richard's group was just talking about, really was meaningful in San Mateo County.
And just to add to that, I think each of our departments also has a quality assurance or quality management department that helps kind of navigate some of these compliance issues, that also have strong relationships with our county council, that also then supports our processes as we move forward.
And finally, I can't stress enough the importance of our relationship with the County Office of Ed on this, our MOU as it relates to our educational liaisons and the advocacy that they serve on behalf of youth in the context of CFTs when we are making placement related decisions. So important part of our processes operationally in our county.
Slide. I think we could do next slide. A lot of the questions were overlapping, so I don't want us to get ahead of ourselves. So I'm going to just speak quickly to some of the pieces around information sharing that are connected to right now, regional center and special education as well. As we've been sharing, we have lots of opportunities where we are trying to be student focused and quality information sharing focused. So of course, different team members may bring to the table specific things that are related to that student and the need at that team meeting. But we do all have currently meeting protocols, or protocols is probably the wrong word, meetings set up with our other partners, so that not only do we have this SISOC structure, but I personally, as the SELPA representative, meet monthly with behavioral health. We have meetings with our regional center collaborators around a variety of different topics, at least quarterly. We have other partnerships that ensure that we are connected with each other. The foster youth liaisons consult with SELPA when they need to on special education issues. The foster youth liaisons are able to consult with, of course, the CFT and any of the other service providers. So we're really trying to make sure that each one of us can make available to the other system partners the key and critical information. So for example, if a foster youth liaison needs access to appropriate IEP paperwork, 504 paperwork, or other student level plans, then we can make that happen at the County Office of Education. And if we're needing to make those connections with Regional Center, both the SELPA and BHRS and Child and Family Services have those connections as well.
I think the other thing that I would add, and I think everybody's speaking to this, is that all of our children or all of our youth are our youth. We don't differentiate between that's an ed youth or that's a CFS youth, but we all work from the principle that these are all our youth that we're going to be serving. In addition to some of the processes that Ann Jeanette had mentioned, and I don't think we've discussed this yet, but in our IPRC process, that's another opportunity for our managers or directors of our different divisions to come together to hear the presentation of the different youth that are being considered for placement. So that's just another layer or another level of one, accountability, but also an opportunity to have a process between divisions to discuss what is the best decision for this youth as placement is being considered. We also have other processes such as school-based mental health collabs that meet regionally, depending on where they are in the county, with the different partners that are also discussing high needs from the school perspective, as well as the mental health perspective. We also have our SELPA MOU that talking about that outlines some of these protocols and processes, as well as other processes that we have that integrate some of the dynamics that happen between the two divisions to work out some of the kinks that sometimes come up. So when we're seeing things differently. We also have a once a month meeting with a GGRC for those high-end complex situations where we'll bring our partners from GGRC and BHRS together to discuss a case more in depth to decide what decisions are going to be made, especially when it comes to placement.
Thank you. Yes, IPRC is critical. They meet weekly. So we have a constant a possibility for connection. Thank you for reminding me about IPRC. I think we can move on to the next slide. So our next slide was alignment of services. That is really speaks to what Ziamara was just saying, and that we have a bunch of processes or connections in place that helps us make sure that we are working together in alignment rather than at cross purposes or in a way that would be duplicative or even really conflicting from either a resources basis or an ethical basis. And so we try to make sure that we are sharing sufficient information to know who's doing what for each student so that we can make sure that we are meeting that student's needs and that the right system provider is engaged with that student. And Ziamara, you may have more to say.
No, the only thing I would add to that is I think it's important to recognize that sometimes some of these situations get escalated to managers or directors, but it's really our frontline staff, therapists, teachers, counselors that are working on the ground that really understand the overarching perspective and the overarching principles that we're working from. So when there is a need or there is a request for a certain escalation, it's almost as if our divisions know how to escalate each of the different divisions know how to escalate it to bring it to the appropriate process or forum to be able to discuss it further and deeper. So I do want to give a lot of credit to our staff that's doing this work day to day that really also carries these principles from a very trauma-informed perspective as well.
Agreed. Next slide. We're almost finished, so that we can have questions if people need. We also have been, as John has been saying, re-looking at the current MOU and the existing relationships and trying to figure out ways that we can incorporate other partners, including places where there are already existing relationships and including parent and student voice as well. So one of the things that we currently are talking about, especially with our Department of Rehab partners, is the possibility of also utilizing the local partnership agreement. And some of you may not even be aware of the fact that there is actually a document, another process called the local partnership agreement that requires Department of Rehab, Regional Center, and school districts to have a relationship around providing support services to young adults and youth who are going to need services after their comprehensive high school program. Primarily, they work with youth 18 to 22, but there are youth who get services from those agencies in their high school years, so between the ages of 15 to 18. And so one of the things that we've been discussing is how to expand or utilize some of the partners in the local partnership agreement to also make sure that we're developing even stronger communication channels in between those people who are providing services outside of the SISOC team. Because we really have found in San Mateo County that although we have a lot of mandated activities for system-served youth, that many of those activities are really appropriate for many more youth in our community. And because of our communication and collaboration, we're able to actually provide lots of supports to youth using those same kinds of processes. Any other thoughts from anyone else? Okay, so I think that's our last slide in terms of things that we're currently working on or how we've used our history. And we really are fortunate that we started from a place of a strong foundation. It's actually been a little bit of work to try to make that foundation meet the needs of new structures, but we're still really committed to that work, and we're so looking forward to continuing our conversations with Regional Center and with those other partners that may not necessarily be formal partners for ILT, but that we want to make sure that we have more opportunity for our community to be part of those conversations. So any final thoughts from anyone else?
I just want to thank all of you for joining us today. The information you shared was great. We do have a few requests. If you could share your MOUs that you have developed to use as models for other folks to take a look at and how you've done that. And I did see that you responded in regards to the broad information sharing agreement. If you want to share that back with our system of care team, we are happy to send that out to the folks who participated. So we'd appreciate any of that because we do have folks requesting that. We do have a question. How do you inform youth, parents, legal reps about county's information sharing agreement so they understand the information will be shared with whom will receive this information? Do you give children, families a copy of the agreement?
I'll go ahead and start this and then anyone else chime in. So as Anjanette was saying earlier, we are so fortunate to have Claire Cunningham, our county counsel, really be a strong partner with us as we're trying to figure out how to proceed forward with honoring the laws. But we're also really fortunate that in San Mateo County, Claire Cunningham is part of county council. So she literally sits in the office with the councils from all the agencies represented here. So as we've been able to ask for support from our legal counsels, they've been able to have those conversations and really then turn back to their respective agencies and help us embed it into our practice. So on that note, what we do, and I can speak to education, is we do continue to remind, we talk about the fact that we have this broader agency, this broader agency agreement, the purpose of it, which is to support young people to partner, and that we ask our families we still ask for active permission to share information as much as we can. We want them to be informed participants, but we are able to demonstrate. We don't, as a practice, share it with them when requested. We do, but we are able to assure them the purpose of this is to support their young person. And so we've been really fortunate, especially after we got through our first hurdles back in 2015, 2016, we still hit, a few folks that push back, but in general, when they understand the why and they understand how each agency is leaning in and the purpose behind it, we haven't, at least from the education perspective, really hit, significant barriers as a whole. It helps, it actually is a tool that helps the folks on the front line even frame the conversation with our partners, the families, et cetera, so they understand where we're going with the information and why we're requesting it.
Yeah, I would say it's a similar process on BHRS, and we do actively try to attain releases of information, either verbally or written, to be able to move forward. But usually the dialogue is already in discussion, and we do frame for families and caregivers the reasons why we would be attending an interagency placement review committee, or why we would be attending the complex conference, to really, and once they understand the reasons behind it, 9 out of 10 times they're in agreement with it. When they're not in agreement with it, then there is continued discussion between the provider and the family about what the concerns are, to try to really address that piece first, and then move forward. So again, as I was mentioning earlier, it really is from the line staff all the way up in terms of what's what the what am I trying to say? What the vision is in terms of this work together is.
Well, thank you all again. I appreciate your time this morning and sharing your practice there in San Mateo County.
Thank you for having us.
Thank you.
Thanks, everyone. Have a great day.
Thank you.
Can you forward to the next slide? Okay, maybe the next slide. So I would like to take a moment to welcome Lassen County, who is also going to be sharing their practices that they do in their county. And I'm going to ask for Megan Patterson to come on and introduce anybody on her team.
Good morning, everyone. My name is Megan Patterson. I am the Supervising Deputy Probation Officer with Lassen County. I will let you guys know that our foster youth coordinator was unable to make it with us today, so you get myself, the supervisor, and Jen Branding, the chief of probation today. And to get started, in Lassen County, it's a little different. Our foster youth services program is actually ran out of our probation department. Oh, can I get the next slide, please? So it's ran out of the probation department, and we placed our contact information on here just in case anybody needed to contact us afterwards, so they had this information.
Next slide, please.
So foster youth services is a statewide program. As you guys know, it's county operated through the probation department with MOUs and collaboration between system partners.
And we would say that in Lassen County, that's one unique piece of our program, because no other program in the state is housed and operated within the probation department. And with that, our foster youth services coordinator gets the benefits of all of the MOUs that we have with all of our system providers, which is child welfare, behavioral health, community social services, as well as our truancy reduction program with all of the schools. Next slide, please.
So our foster youth program was created in alignment with the
academic challenges and successes that we see with some of the youth within our system. Our foster youth typically have very poor educational outcomes. And one thing we found is when we engage with the youth, we see better system outcomes. We also see a reduction in duplicative services, and we've also seen more of a team approach to be able to help the success of any foster youth that we have within our county.
Our coordinator is able to assist in facilitating the collaboration between the teams and removing those educational barriers that our foster youth usually face. As Branding said, one third of foster youth attend 2 or more schools during their time. So our ability to follow them from Lassen County to a different city, state, wherever they end up going, has really facilitated them having higher graduation rates and lower dropout.
Next slide, please.
How did we get here? AB 490, Every Student Succeeds Act, the local control funding formula, and then AB 854.
Those all kind of really, next slide please, those all really kind of outline what it is that we do as a foster youth services program, and it also really speaks to some of the work that we do with them, who's considered a foster youth, and outlines some of those services and duties and tasks that we have, which in Lassen County are very different, since we're able to enjoy all of the MOUs that the probation department has, and the foster youth services coordinator really works with all of the school districts through our truancy program, and really works at finding out what those educational barriers are, whether it be outcomes, whether it be, they're just not as caught up, they're missing different schoolwork and behavior problems. So we really see a lot of coordination with that care. Next slide, please. Oh.
Or, I'm sorry, will you put the whole slide up?
There we go. And that's just kind of an explanation of, I think there may be one more in that slide. There we go. And our foster youth services coordinator currently also supervises the AB 12 youth within Lassen County. And we did that because the foster youth services coordinator is more of a mentoring kind of program, and really works with youth to adjust to different situations, and they really work for those educational outcomes. So what we saw was a better rate of entering into college and post-secondary education, and really becoming more engaged in that process. So our coordinator supervises that population as well.
And it also broke up the differences between going from probation to AB 12. Instead of having the same person supervise you that was coined your probation officer, it helped break that up so that they could build a stronger bond with that educational or foster youth coordinator.
Next slide, please.
And you can click all the way down to tutoring. Perfect. So as we've discussed throughout this, we do provide educational case management services through our foster youth services program. We attend meetings with foster youth, with community partners, and then all together with the foster youth, school, caregivers, caseworkers, parents, anybody that we can get that's going to support that youth, we make sure that they're at the table. Our foster youth coordinator attends our IEPs, CFTs, and we have access to Foster Focus so that we can have access to their attendance through the computer or through the school system. We don't have to ask the school, we just have access to it. And then we assist with the disciplinary process and tutoring.
So I would say that one thing we do is our foster youth services coordinator connects with all of our foster youth liaisons in the school districts, also connects with all of the social workers at child welfare, because our coordinator takes care of all foster youth within the county, not just the probation department ones. But one unique thing that our coordinator in our program has is access to probation data, to child welfare data, to foster focus data, and to CalPADS data. So now we have one person that has access to all of these different data points, and it really makes it very successful in being able to report back to the social workers, the behavioral health department, through those CFTs, where that individual youth's barriers are and who it is to best serve their needs. So we also really rely a lot on educating some of our partners, and we were able to have the Alliance for Children's Rights come to Lassen County, and they presented to all of our partners on their courtroom companion toolkit, which has been a very useful tool for everybody to see that there are, that we do have the ability to share information, sometimes outside of different welfare and institution codes. and that everybody has that ability to provide that update to each other.
And again, this is all through MOUs. How we coordinate with all of our partners is either through an MOU with the probation department, waivers, just to let everybody know that it is through an MOU that we have all of our ability to communicate.
Next slide, please. So all the way through that one, what we do, we really do a lot. We make sure that all of the kids in foster care have educational supports and the services that they need to succeed in school. We currently operate a tutoring program. We offer tutoring 4 days a week for 2 hours a day after school. And we recently expanded that because we surveyed all of our youth who attend, and the one thing they said they wanted was more tutoring. And what we found is that they get a lot of mentoring within that tutoring program as well. And what we found too is, you know, our foster youth have so many services that they have to attend. They have so many people in their lives. They have so much on their shoulders that they get behind. And when they get behind in school, and it could just be 1 week behind, that almost seems insurmountable to them to be able to catch up. So our foster youth services coordinator monitors their grades, ensures that they're turning in their schoolwork, has parent access to all of their educational data. Our coordinator also keeps track of when the foster youth have court, and prior to court, they provide a one-page update on where that youth is currently in school, if they've had any behavior problems, who they're who's the educational decision maker, if they're in their school of origin, what their grades are, what their attendance is like, and what their behavior is like. And what we've really seen is an increase in that school engagement, and social workers and probation officers and counselors, they have a lot to do themselves and they have a lot on their plate. And just being able to have that one-page report from the foster youth services coordinator on all of the supports they're receiving educationally has really been beneficial to them.
And to add on to that, our tutoring program would not have been possible without the collaboration of our Lassen County Office of Ed. We have a great partnership, and she's really assisted us in making this dream come to fruition.
I think our relationships that we constantly build by being present, and instead of just sending an email or something like that, a lot of times we'll just go have that face-to-face communication, pick up a phone, be able to just really work together to say, what can we do? How can we partner? And how can everybody join together and pitch in to create the best outcomes educationally for our foster youth? Next slide, please. So,
do you want to click through this to medical records? Keep going.
So one thing that we do is we also coordinate our independent living program. So a lot of our youth in care who are receiving tutoring services and services through our foster youth services program are also in our independent living program. So we've kind of just joined those together to make sure that all of our students have the ability to have access to these services and to the service providers. All of our providers, they just really have a different outlook with our youth when they work in the capacity of ILP and tutoring, because they're there more as those mentors, and that's a lot of what they receive.
And then if you want to click through all the way down to medical reports. So the health and education passport is something that our foster youth coordinator pulls together for probation and child welfare to make sure that all of the information that she has received over the period she has been working with the youth has been inputted into that health and education passport, which, as Browning said earlier, we send to the court if needed. And it really makes sure that if they move from Lansing County to another county, it has all of the information in one place to ensure the continuity of care for our foster youth, to ensure that everything that Lansing County has done for the youth can be replicated in another county.
And so what we also do is, I think as you see the picture in the slide that has our Youth Empowerment Summit, and what we do every year, minus our COVID year, we typically have a Youth Empowerment Summit. And what that does is it educates all of our foster youth. It provides education materials for service providers, for educators, and for court personnel. Everybody comes together, and we have a lot of really good providers that come and talk to their experiences in foster care and different ways that everybody can work together to succeed.
And with the Youth Empowerment Summit and tutoring and mentoring, it has been noted that our school suspension has been lower for foster youth, better grades and positive relationships for the youth, because they get to associate with other foster youth and learn they're not alone.
Mm-hmm. Next slide, please.
And you want to click, oh, yeah.
And so what we do with our post-secondary education is our foster youth services coordinator makes sure that all of our seniors in high school are completing their FAFSA so they can get their financial aid. We also take all of our seniors on trips to college campuses that are within the area to look at different programs that they have, to make sure that we have, given them every opportunity. We also like to take them to the California Conservation Corps and some of the other Job Corps, places where they can get if they don't necessarily want to go to college, because college isn't always on the, high on the important list with our foster youth. So we make sure to give them a wide variety of options and opportunities. Can you go ahead and click through advocacy as well? Thank you. So what we do is when we have our foster youth who change schools, who want to go to college, who may have a different outcome that they want to receive through a trade school or a trade workshop or something like that, we really work with them one-on-one, and our foster youth services coordinator or the assistant in the program will take that youth to the college and sit down and go through the whole entire process with them, so that they have someone that's there with them who can ask some of the questions that the youth may not feel comfortable enough asking. And our foster youth services coordinator, most times we'll have youth return 2-3 years later to help them out again. So I think that advocacy piece is really important with our youth.
And another edge of the advocacy route that our foster youth coordinator does is they will fight for that youth to enroll in the same schools or the school that they want to. We've had many matters go to the state. Our foster youth coordinator will go to the state and fight for whatever right that child wants, to ensure that they feel like their voice is being heard in the situation. Even without their parents there, they have us as that advocate that will go to the state and make sure that their rights are being met. And there's two other, if you can click 2 more times. Extracurricular activities is another thing that our foster youth services have always fought for, making sure that just because they're in maybe an alternative ed classroom setting because of being moved around schools, they will fight to ensure that they get to play football if that's what they want to do, which has been great for our youth to build their positive relationships within that sports arena.
Absolutely. Next slide, please. So if you can click through all of those.
Perfect. Go back one.
So again, it kind of explains part of our partnerships, and in this slide, that's all of our partners with probation and the Office of Education within our little team. I say it's a little team, but it's a mighty team. One of the things that we make sure is that we really track our data and our communications. And I can't stress the importance of being able to communicate with all of your partners through child welfare, through probation, through the school districts, through the Office of Education. Because when you come to the table like that, you're able to really utilize every resource to make sure that youth succeed. And when we build those relationships, it's very easy to look at each youth and say, what can we do for this youth? Not what can we do for our agency or what can we do for ourselves. And it's a true partnership. And we share funding in so many different ways with child welfare, with probation, just to make sure that each youth gets their needs met and they have a better educational outcome and a better reunification rate and a better chance for success in whichever path that youth is going to take in their future. So next slide, please. So how we share a lot of our information and data, what we do is we do track educational outcomes. We track GPAs. We track all of their grades. We look at, are they increasing? Are they not increasing? And what we did find is that the youth who attend our tutoring program, their grades tend to be in the A to B range, where those youth who do not attend tutoring tend to be in the D to F range. And so what we've done is really looked at that to start that tutoring program early on in the year to get any youth who's in foster care assigned and referred into the program so that we can start monitoring and watching that. What we do is our foster youth services coordinator attends all CFTs, all IEPs for any foster youth. And because she has the link with child welfare, with probation and the County Office of Education, it really makes it more effective in being able to ensure that those educational outcomes are met. One thing that we also make sure that our foster youth services coordinator has is probation departments have access to the child welfare databases, so CWS, CMS, and typically that's a statewide database where all placement information and all youth on or all information on those youth in care is located. But probation's data sometimes is lacking in that system because that's not the same statewide database that probation departments use. So our coordinator has access to the probation department database, which is really essential in being able to meet all of those youth's needs and to identify all of those youth. Because she takes that information and then looks at foster focus and CalPADS to match any youth who have been marked in foster care within our county so that we can track them. Some of our outcomes really suggest that our program is very effective because our youth have higher educational outcomes. Their rate of post-secondary education is higher. They really are engaged more within their schools. They become more engaged within their community. They see that it's okay to ask difficult questions and that, you know, their education really is what they want it to be. And I think some of the things that you can't necessarily track is school engagement and how much those tutors and our foster youth services program coordinator and the assistant really become mentors to a lot of youth. And those youth really come back and ask for assistance and ask for help later on when they just don't know where else to go. And I think one thing that we've found as well is that when our youth don't get behind in their work, they feel much better about education because it's almost like an insurmountable task if they're behind to get caught up within their schoolwork. And that's just one less thing that they have to worry about. Next slide, please. So that's our program in Lassen County and how it operates here. So thank you very much. We appreciate the opportunity to be able to talk about our program and really highlight some of its success.
So thank you both for sharing today. We do have a couple of questions for you. One, of course, is, are you willing to share your current MOU that you use so that we can send it out to other counties?
Yeah, we will definitely share that if we get that written down. We'll definitely share that, and it's a very simple one, just because it's between the probation department and the County Office of Education.
Very good. Another question here is, can you share a little bit about how you work with your mental health plan?
Well, our mental health provider is always at the CFTs. So we really work closely with them. We ensure services are provided outside of the school day. We make sure that there's a connection between the school counselor, if a youth is receiving services there, and the county behavioral health provider. We make sure that we connect them so that there's no duplication in services. When there's an overlap in different areas, the counselors and therapists will work together between the Office of Education and through the behavioral health department. And I can really say that our foster youth services coordinator is that glue kind of that holds everything together for some of the cases and some of the families, because you really are that connection and that one person that typically knows a majority of what's going on in the case and what services someone is getting, to make sure that we're not duplicating services and that all of the services are being provided to meet specific needs of individual youth and families. So we work very closely with them in that.
Thank you. So we have a question here from Megan. It says, when you mention data sharing, is this an release of information or general information sharing?
A lot of it is general information sharing, because the individualized data will go to the social worker or to the probation officer for that youth. But what we do is we track a lot of overall data to look at how many youth did we have that entered care, how many graduated, how many had, where were their educational goals at, where were their grades at, were they able to move on to the next grade, did they reduce the number of behavior incidents that we had before. We also use an assessment that's called DIBELS, and it tests where somebody is educationally and whether they have the ability to meet the concepts and understand concepts. So we have that assessment that we look at some data from as well.
And we also—
What was the name of that assessment?
DIBELS, DIBELS.
And we also send out personalized surveys for the youth to ensure that the services that we're providing them are assisting them in every way that they are needing assistance. And then if they have any information that they want us to add into it, we can look at revamping our program to fit the current needs of our youth.
And so Megan is right with that. We do survey the youth and our service providers to make sure that everybody knows who to contact for education outcomes, educational issues, issues with behavioral health, to make sure that they know where all of their resources are. And if they don't, then we try to provide that information in a fact sheet. We have worked with a local provider, QSO Technologies, to help develop a website that's very interactive, that has all of our foster youth services information on it in one place that's very easy to find. And we typically send a lot of our service providers and foster parents, resource families, and group homes to that web page because there's a lot of tools on that.
Thank you. Can you share one piece of advice that you would have for your colleagues throughout the state in regards to the 2083 and the work of the system of care?
I would say that if you look at wanting to see the best educational outcomes for our youth, because eventually our youth are going to become adults, please really involve your foster youth services coordinator. And I cannot suggest, I can't stress enough communication. Communicate, communicate, communicate. We may not always see eye to eye. We may not always agree, even within our own county, but we set that aside and we communicate and we work for the needs of our youth. And when we do that, we see amazing outcomes. And so I'm going to say communicate. That's one of the strongest pieces of advice that I can give.
And making sure that the youth have their voice as well.
Mm-hmm.
Well, thank you very much, Lassen. Appreciate your time today and sharing with us.
Thank you for having us.
Thank you for having us. We appreciate your time.
All right. So here are some resources. Oh, do you want to go back one slide? Just 1 second, everybody.
Hey everyone, sorry, my computer just really kind of went bananas on me. I will see if I can get it back. Oh yeah, something really weird.
Thank you, Nancy.
I need to stop my screen share and see if I can pull this back. Okay, I'll be able to share my screen in just a minute. This is kind of actually, I'm going to take a second. So I have a Bluetooth keyboard and I wasn't using it. And my child, because we're all working from home, grabbed my keyboard and just started typing on it, which is why everything went. So anyway, that's just kind of a comical, hopefully there's some people who might be able to relate to funny working from home stories as they happen.
Love it and definitely appreciate it.
Okay, so let me get my bearings back. That was so bizarre. So we're on the resources section.
While you're doing that, Nancy, there's a question in the Q&A section about confirming the schedule for the next TA call. And we do have that planned for November. We have planned to not hold a call in December, and then we'll provide updates on the next calls. But when you register for the series, you can get all those dates there. I'm gonna pop that registration link back into the chat box for everyone.
Thank you, Ashley. All right, so here are some resources for the information that was discussed today and that will assist you guys in your MOU development. Go ahead and go to the next slide now. And these should all be in links as well. Do you mind going to the next slide there, Nancy? Thank you. And we love when counties share how their MOU development is going. So if you would like to present on any of the topics here below or any other areas of the MOU, please be sure to contact us because we would love that. And then go ahead and go to the next slide there.
That's all we've got.
All right.
So I think unless there are other questions or any other comments from any of the other panelists, I think that just about does it.